We have two sort of approved agents in that space. We have trifluoridine tipiracil, or Lonsurf, trade name, and Regorafenib, or Stivarga. And so these two drugs have never been compared head-to-head, but they've each been compared in pivotal data to supportive care, because that's really the standard in patients who have refractory disease. And both of them offer an advantage. I think using them early enough in the course of illness is important, because they can provide benefit for patients. But with the Regorafenib data, there was some concern, and I think once the drug was used in practice outside of a clinical trial setting, it got a bit of a reputation for creating more toxicity than maybe providers and patients wanted to deal with when you're in that difficult decision between prolonging survival and accepting toxicities, where quality of life becomes a real key feature that we're focusing on. So this study looked at trying to use a different dosing strategy. It started at a lower dose as opposed to the standard dose of 160 milligrams daily. They started patients at half of that. And then each week that they were on therapy, the dose was escalated to individual patient tolerance. And the study was pretty convincing in that it showed better tolerance. More patients were able to stay on the drug for a longer period of time and hopefully provide benefit to those patients. And so that's, I think, going to become probably a more frequently utilized dosing strategy, and I think it'll probably benefit patients in the long run by exposure to more effective therapy.